Spiritual well-being, what do you think it is? What does it mean for you? What might it include? When we talk about spiritual well-being, the word spiritual is mystical. They don't quite know what to do with it. They don't quite know where it fits. They sort of know it's part of holistic care. What do we think it means really under the skin? And so what I wanted them to do was to realise that they're already working very hard at it and getting some really good opportunities to support their patients.
For me, it's more about, the essence of the person. So what is important for them.
Taking time for yourself, being mindful.
This was very interesting because you don't often get to shadow other people and see what they say or see what their experiences are.
You're in a resource.
You always have to be really careful not to impose your own feelings upon patients.
For me, when I discuss with my patients, I normally see it more as what people do in their spare time to relax, to enjoy themselves, what makes them feel human, makes them feel them.
This is not a small topic, really. What sort of things came up? Let's just get them out there. I think a workshop like this offers a really useful space in which to test out and reflect on those moments where perhaps intuition and experience have come together and you've had that one of those moments of connection with a patient.
Food aspect of life.
Food is something to celebrate.
Yes.
Yeah?
While as a dietitian, I'm very interested in food in terms of whether someone is getting enough nutrition for their treatment. To a patient, that might mean something very different. And I think when you lose that, or if you lose your appetite, food becomes even more important.
So you are looking at the whole person. You're not just looking at what they're eating.
Having the dietitian there was really interesting, I think, for the group as much as for the conversation as it unfolded, because working in a multidisciplinary team is what we do.
It was really interesting just hearing other people's input. Spirituality can mean different things to different people, and it's trying to sort of explore what that means to that person and whether you can then help with the resources within the hospital.
With spiritual, we sort of say, oh, would you like to see the pastoral team? They say no, we say okay. We don't say, would you like this, that's what the pastoral team can offer you.
Yeah.
And remembering that those other support networks are out there.
Around, yeah, absolutely, yeah. It's about what gives meaning, what gives purpose, what gives hope. Those things which we've started to unpick a little bit there. It's good practice in all contexts of healthcare that there is some sort of holistic needs assessment, particularly at the beginning of a trajectory of treatment. You use a form, or there's various ways I think everybody does it. I thought it was really useful to encourage the group to talk about that and explore the different ways in which they do it from their different specialist areas. Possibly not using that word.
Every nurse I know does holistic needs assessment in a different way, and there's no right way to do it. It's the way that you feel comfortable doing it with patients.
I think for me, going into a room, you're going coldly into a room, but you can pick up on the body language and the atmosphere quite quickly. With the previous patient, we spoke about her symptoms of hiccups, and it's just gone New Year's Eve, so I said, oh, was that the champagne? And we all laughed and then went back to it. But I think it just shows that you're listening, maybe just sort of lightening the situation, but then going back to the seriousness of it. It's good to be safe, isn't it? I'm not going along with a tick box of questions and answers. I'm sort of being human about things.
Thanks.
Thank you.
It isn't always about what a patient says to you, it's about the non-verbal communication, the eye contact, the tone of voice, their actions, any hand gestures that they may do, picking up on all of that.
Help with my needs, really.
I'm not just here as a dietitian, so I'm not just here about the food. That tell me how you're feeling, tell me what's important to you, and that can mean bringing up other, personal issues or life experiences, and they are really important conversations to have.
It's getting to people in the early part of their journey, whatever that journey is, through the clinic or through an inpatient admission. And I think it's how are we supporting that to happen for you guys to really support your patients. In the larger group, as we reflected together, and I sort of felt we got down through the layers to what really counts. And we started to touch what had been the poignant moments for them in their nursing experience, in their caring for patient experience.
Yeah, and it can be hard because sometimes people don't want to do what you know would help them.
Yes.
But again, it's their choice, and we have to.
And that's what we're talking about. It is, you know, it's the test of the human spirit.
Yeah.
What's your experience in the room?
Even though I'm going as a healthcare professional, you want to be like, just take some morphine, it will help with the pain. It's not what everyone wants. So it's trying to encompass people's views, to try and help them their way.
In their mind, they've just got a fixation of, I don't want that for whatever reason, and unpacking it and hearing it can be really, really important. I thought one of the most big wows that came out was when Thora spoke about walking into a room and the only thing she could offer was her presence.
There was this man that had cancer. He had one treatment after the other. In the end, time came where actually there was no more options. On the day where he had actually been told this earlier, I came in to see him. And I walked into his room and it was like I was walking into a dark fog. And I sat with him. And I could only sit with him. There was nothing I could say. I could not do anything to make things better. But I could offer him my presence.
We're dealing with what we would call spiritual pain and distress. And we know that actually if we can support people well at that point in life, in the moment, then actually we've got a really good way of coming alongside. I think one of the things that we don't often think about is what distress is. And actually to label something spiritual distress may sound very odd, but what we're getting at is what is affecting that person's sense of self.
Getting a cancer diagnosis puts a label on someone that they're a cancer patient now. It's what people will always ask you about. If you're stopped in the street, that people tend to be, oh, how's your cancer treatment? Are you on chemo? They stop asking you questions about you and how you are and your family. So it's really important that patients are encouraged to be themselves, that it's okay to talk about other things, and that opens up a conversation.
When you're thinking about engaging, this is the first question to have in the back of your mind. It's not necessarily something you ask somebody. What are you experiencing about how someone is coping? What would you look for?
Sometimes someone will say they've read all the literature, they've heard this is good for you and that's good for you, but you feel they're being quite overzealous in telling you that they're coping, when actually you need to think, okay, maybe we need to just unpick this a little bit because maybe they're overcompensating for their anxiety.
Great. You've got the person who's trying to say they're coping because they're trying to keep the relative happy. So often, the distress for people in their illness is, I don't want my family to suffer. You know, I don't want to be a burden to them. I don't want them to know how I'm really feeling, and so they try and kind of act up their coping in order to prevent their family from suffering, and that can be quite complex. We can sense whether or not they're coping, and then we can get a sense of, you know, where's their relationship with their essential self going? What are their thoughts about the days and weeks ahead?
I think realistic hope is very important. Being honest with patients leads to having better discussions about what they want to achieve and giving them the tools to achieve that, and that may be involving the dietitians, the physios, the palliative care team.
How do you do that one?
So just picking up on the clues from what you can see, but also who they refer to in the conversation as well.
Or what they refer to, it could be. Whilst there's great wisdom in the room of how they are operating themselves, one of the things that came out was listening, and listening at that really deep level to what the patients are saying.
This type of workshop is very helpful because I think it makes people think outside the box.
The last one, anything we can do to help?
Being truthful.
It's about being honest about what really is going to be.
And who will be there.
These questions are your friends, and you're doing them all the time. Those 4 basic thoughts gives us an opening to understand what might be a need, and then we can think about how we signpost them.
I think it's always helpful to have a discussion with other people, you know, people that you're not generally working with on a day-to-day basis, because you never know, you know, what you may learn from that.
In my role, we've got a lot of support systems that help us to help the patients. We can refer to complementary therapies, counselling.
For us to be able to support people in the situation, we need to look after ourselves, we need to work together, we need to be able to share. So I think, yes, it's really, really helpful.
You may never ever use this word. You may simply say, would it be helpful to just talk that through with somebody? There's equally wisdom in the life of the patient that we need to hear and work with rather than against, so that we can be companions in the journey of support through the treatment, the illness, whatever comes next. And you've got a wide open door and they can choose to walk through it. And you've never focused it in something that makes them think, woohoo, what's that about? Because you've heard that that's important to them.